My name is Alondra, and I chose the title, What is Cancer and How Does It Affect Children? My research question is, how does emotional stress caused by cancer affect children under the age of 13? What is childhood cancer? Childhood cancer is the number one leading cause of deaths in children under the age of 18. There are 12 major types, including leukemia and brain tumor, which are the main cancer types in deaths. Cancer is more aggressive in children than it is in adults. Every day, 43 children are diagnosed with cancer. More than 40,000 children in the United States each year undergo treatment. 12% of those children do not survive, and 60 of those who do survive cancer suffer from late effects, including they can't see very well, they can't talk, they can't learn, they have difficulties learning, and there are approximately 375,000 adult survivors. The need for progress. Today, pediatric cancer patients are still being treated with the same drugs that were found in the 1960s, 1970s, and 1950s. Why? Because childhood cancer is really rare. You don't see it much in children as you see it in adults, and it's really rare, and they haven't found a treatment for cancer. The battle after treatment. Because children's bodies are still developing, toxic therapies damage more than just the cancer cells. They also damage the healthy cells. Proton therapy is not as bad as chemotherapy because proton therapy stops it from entering the other side of where it's being treated, and it doesn't affect the healthy cells. The healthy cells that are being harmed tend to give side effects such as talking, hearing, and even learning disabilities. What can we do to help? You can help scientists research by cure by donating or fundraising to support childhood cancer research. You can volunteer and start a support group to earn money and send them to the scientists so they can actually find a cure for cancer. We went out to Proton Therapy Center. We got to talk to Emily and Shelly. And we interviewed them, and they told us about what they do. What is proton? Proton enters one side of the brain, or where the tumor is, the cancer, and it doesn't enter the other side. It doesn't go to the back of the other side. That's it. Oh, and after we went to eat with Chuck Paskey, our mentor chef. Do you guys have any questions? Yes?
How did you find out about the proton therapy?
I went online and looked up centers where they give therapy for cancer, and that was the one that I found. And you also can see it on TV.
Was proton therapy, is that brain only?
No, it's wherever the cancer is.
Okay. Because there's, besides like traditional radiation, there's two types of new treatments. Proton therapy is one.
And then photon therapy.
And there's gamma also, but gamma can only be used in the brain, but it's the same thing. It pinpoints to destroy the tumor and the cancer without harming the healthy cells.
Yeah.
But gamma can only be used in the brain. Yeah, so that is the most, proton is the most advanced.
Mm-hmm.
Do you know how often they're using this for children with cancer?
How often?
Like, are they like shifting instead of using chemotherapy, trying to go more towards proton, or is it still too new for them to really?
Well, it depends on what their diagnosis is, and then the doctors decide what is best for them.
So what is some of the stuff that causes them stress? Because you mentioned stress at the beginning.
Family, like parents, they don't know what their children are going through. They see them suffering for what the chemotherapy does. They lose their hair. They can't play with children like with regular. They can play outside.
Were you able to visit any kids with cancer?
No, we couldn't.
Why was that a problem?
We couldn't get the application to go in.
So what kind of procedure do you have to go through to visit kids with cancer?
You have to have your shot records and
For how long is the application? Remember? Did you, is there more than one place that, that they can stay if they're having treatment?
Yeah, so the Ronald McDonald's house is located at the OU hospital. They can stay up there for 3 nights, and if they need to stay more, they have 2 other houses they can stay up for 30 nights. They can do their laundry, they can cook, and they can take showers there too. They don't have to pay for nothing.
Any more questions? Thank you very much, Alondra.